Early detection is key when it comes to treating cancer.
There's a program at UConn Health that is doing just that and saving countless lives.
Melissa Cole spoke to a couple who is here today because of it. Take a look.
Married couple Kim and Henry Sicardi of Plainville are patients here at UConn Health, and both are standing here today thanks to early screening and early detection for lung cancer.
We're really trying to make a push here at UConn Health to find these patients early, to treat them early, and that's through screening.
Dr. Omar Ibrahim, the director of thoracic oncology at UConn Health, says that in many cases, by the time symptoms appear, like a persistent cough or coughing up blood, the cancer may be too advanced for a cure. That's why early detection for lung cancer is so important.
For lung cancer screening, one of the most important things we look for is that the patient is in the age of 55 to 80, that they have a heavy smoking history, as well as they haven't quit in the last 15 years. When you quit smoking for 15 years, your risk actually drops down significantly. But there are other things that we want to pay attention to, such as a family history.
I started smoking when I was about 13. I was very young, and I was smoking Marlboro Reds. And back then it was the thing to do. My parents actually gave me permission to smoke, and I never stopped. I just kept smoking, and I was up to close to 2 packs a day.
I smoked very heavy as a young man through my whole life. As long as I was awake, I would be smoking.
And then in 2011, I came down with something called Kienbock's disease in my wrist. And I needed to have a whole row of bones removed in order to fix it. But the surgeon wouldn't operate on me unless I quit smoking. And that led me to stop smoking. And I quit in 2011.
In support of his wife, Henry quit then too.
About 5 years ago, I got sick, I was coughing, and I fractured a rib with no explanation. And at the time I was working for a breast surgeon, and he decided to do a CAT scan to see if I had pneumonia, what was going on. And lo and behold, I did fracture a rib, but they found a nodule. They actually found 3 nodules on my lung, but they were very, very tiny.
Kim enrolled in the screening program at age 52, and doctors watched those spots carefully.
For a couple of years, I was good. And then all of a sudden, it started to change. And when I tell you, it only changed a little bit. She referred me to Dr. Ibrahim. And the next thing I knew, I was having a bronchoscopy done. They were pretty aggressive with my treatment.
Luckily for Kim, the cancer hadn't spread. She didn't need chemotherapy or radiation, but she did lose a small part of her lung. The prognosis for Henry was more intense.
I never really went to a doctor, all my life basically. They would always try to make me go get checked. But when she was going through all this, I decided to get checked. And they found a little tiny something, and it turns out...
But at first they weren't impressed with it.
Right.
They just watched.
Yeah. And they just watched, and all of a sudden it started to grow.
Yeah.
Mr. Sicardi, he's enrolled in our lung cancer screening program because of his history. And so every so often he gets, at least once a year, he gets a scan. So we noticed there was a big change from one scan to the next. So given that there was a significant change, we were very aggressive in biopsying the lesion.
The team at UConn Health discovered Henry's cancer was rare and much more aggressive.
So given that it tends to be more aggressive, we've, through discussion with the team, they opted for a different approach and adding chemotherapy in addition to surgery. But again, because we caught it early, our goal is for cure.
How many more rounds of chemo do you have?
2 more.
2 more.
2 more after this, and it's going well.
So you both feel very, very thankful.
Oh, to
Beyond.
the doctors, to UConn, everybody.
Beyond.
Everybody. It's beyond.
And it's wonderful because they all work as a team.
Yeah.
The Sicardi son is also currently part of the UConn family.
So he's a 3rd year. He's got 1 more year to go, and then we start residency, and hopefully it's going to be here.
UConn Health wants people to know lung cancer screening is available for those who meet the criteria. So talk to your primary care doctor about getting screened.
If you're available to get the screening, you should get it. It's similar to getting a colonoscopy. Every American at a certain age should get it, just to prevent a disease that could be worse if we didn't catch it early enough.
This next part I think is very interesting. Doctors at UConn Health told Melissa that radon is also something that has been linked to lung cancer.
That's often why when you're buying a house, you have to have those
it
radon
checked,
tests.
but they're
And-
saying you should do it once a year.
Yeah, and oftentimes people do get their basements checked when you're moving in, but you're supposed to get them checked more often, they say. So for more information on the program, to see if you should be getting a screening, you can visit health.uconn.edu. We're going to have a link to the specific program on greatdayct.com if you just want to go right there.